Hello, I'm Greg Jamian, and welcome to Boomer Health at Home. As more baby boomers receive medical services at home, there are many questions that pop up that require sometimes quick answers. I have put together a series of short segments with healthcare professionals that will help explain how things work along with answers to common questions found in home-based care. I hope you find the following information helpful.
Hello and welcome to another episode of Boomer Health at Home. I'm your host, Ryan Donlin. On today's episode, we're going to discuss travel. Of course, being in Michigan, it's always nice to get out and recharge the old battery and get away from the winter every once in a while. But what do you do if you have some health conditions and are afraid to travel or not really sure what precautions you need to take? Here to answer these questions and more is the Assistant Director of Nursing for Ameristaff Medical Incorporated, Janet Alderman. Janet, welcome to the show.
Hi, Ryan.
So we're going to talk a little bit about some tips for seniors traveling if they have, a pre-existing health condition and, they're going to head out. So first off, what do you recommend someone looking to travel do right off the bat if they?
Well, the first thing is to talk to their doctor. Have that communication, tell them where they're going to be traveling, if they're going out of the country or just staying here in the United States. There's different health precautions that they might have to take depending on what kind of health problems that they have. So first and foremost is talk to your doctor.
Talk to your doctor. Okay. Now, if they're on medications and they're worried about that, what should they consider when they're?
They definitely need to make sure they have enough medications to last while they're on vacation. Have a list of medications with them at all times because emergencies happen and they might end up in the hospital or something. So they need that list of medications that they're on. Also, make sure when they are traveling, if they bring a pill box or something with them, maybe carry it on in case their luggage gets lost. If they're going for an extended period of time, more than maybe a week, you might want to keep some in your luggage and some in with you at the same time so you have enough to get by.
Sure. Now, I'm sure they probably frown upon certain narcotics traveling from point A to point B. So if someone is on a medication that contains narcotics, can they get like a script from the doctor to prove?
Yeah, they should have a doctor's note certifying that, like their name and why they're on the medication so they don't have any problems when they're traveling. Okay,
great. And another thing too, just thinking of it, we in the past we did the episode on the medical alert and stuff. That would be something probably to consider carrying as well if you are traveling, just so if you do have a medical emergency, you can give people the right information.
Yeah, your allergies, or if you can't talk, you should have that somewhere in your wallet, like to say where your allergies are, what your medical history is. Maybe you're out and about and you take a side trip and your loved one's not with you. You want to have that information with you because if God forbid something happens, then they can find that information on you.
Yeah, and I know also there is travel insurance people can purchase too. If you can never predict what's going to happen, but if you invest a lot of time, hard-earned money into a trip, and there is travel insurance out there as well that you might want to consult with the airlines or with the travel agent to.
Yeah, I would recommend that. Even recently, I went on a trip and we got it because with aging parents, sometimes they can get sick too, and you might have to come home all of a sudden. So sometimes that's a good thing to have.
Yeah,
too.
That's a good point. To cut your trip short.
Right.
Okay, that's great. Do you know, is there any, so if you have special medical conditions, are there any services that you recommend people utilize, or do they offer anything like that?
Oh, there's a lot of different services. You should, so if you're a dialysis patient, a lot of times there'll be dialysis centers where you're going. You have to call ahead and make those arrangements. If you're on oxygen, you can take oxygen. There's different arrangements, so call the airlines. Make sure that they know you're on oxygen. Also, the airlines, when you can have wheelchairs accessible for you, and you might not want to take your wheelchair with you. Sometimes the airports will have that, so call the airport, that kind of thing.
Great. I know at Sun Medical too, we carry multiple devices that assist travel with travel CPAP machines, travel nebulizers. So we don't want. There's a lot of products out there that can help get you out to see the world, but also can continue your treatment with you. That's great. Now, of course, people, you always talk about Montezuma's Revenge and going down there, and people, I think a fear is getting sick while traveling. What precautions can people take while they've made it to their destination?
Well, the one thing is to check out, you can check with CDC and see if there's any travel, things that you should be aware of. I would say use bottled water. If you're going out of the country, if you're traveling abroad, you want to make sure that you're using bottled water or something like that. You want to make sure spicy foods, avoid some of those things so you don't maybe upset some of the conditions you might have. And then another thing that comes to mind is when you're traveling on an airplane, a lot of people with cardiac problems, they're prone for blood clots. So you want to make sure that you're getting up and walking when you're on the airplane, and moving, even just doing leg pumps while you're on the airplane, get the circulation moving, make sure you stay hydrated so you're less use those compression stockings when you're on the airplane so you aren't prone to a blood clot. Okay,
well that's great advice. Absolutely, so travel is definitely an option. It sounds like these are pretty easy things to take about, but very important to consider if you do plan on traveling. But if you have any further questions or would like something further explained, you're welcome to call us at area code 248-288-2270. We can also discuss the various options for medical devices and equipment and even the compression socks within our Sun Medical department. We'd be happy to provide some advice on that. So, Janet, that's all the time we have. Thank you for joining us today.
You.
We hope you enjoyed the show back home, and thank you for watching.